Sorry about that. Okay, you should be able to see that now, guys.
Yep. Grand. I'll start off. So Gary, a nice. So I want to talk about public health, I suppose, it's climate change and health, really. So the part that I'm going to talk for about 15 minutes before Gary talks about this leaflet that we're launching today, on a public health guide for climate action. So I'm going to give you an overview of the connections between climate change and health first. Next slide, please, Gary. So it's useful to kind of state at the very beginning that climate change is the greatest health threat of the 21st century. And that was a statement made by the Lancet Medical Journal back in 2009. Next slide, please. So if it is the greatest threat to global health, then by association, and you can see that the climate crisis is actually a health crisis. And it's been long recognized that the connections between climate change and health are strong. So the UN Framework Convention on Climate Change in 1992 recognized the threat posed to the economy and the environment by climate change, but also the threat posed to public health. So it's stated quite a long time ago. It's also been highlighted in the latest Intergovernmental Panel on Climate Change Synthesis Report, known as AR6, in 2023. And I mentioned the Lancet Countdown there. So the Lancet Medical Journal, they have a particular thing called the Lancet Countdown on climate change and health, which has been running since 2017. And they've been tracking progress on climate change, on health in relation to climate change since 2017, and will continue to 2030. And unfortunately, the trends are mostly negative, so they're going in the wrong direction. So what are the risks to human health that climate change poses? Next slide, please, Gary. So if some of you might be familiar with this, but I like this graphic because it comes from the Center for Disease Control and Prevention in Atlanta, Georgia, in the US. And it's about the impact of climate change on human health. So we know about the general effects of climate change, increasing CO2 levels. We have rising temperatures up to maybe 1.5 degrees centigrade now, rising sea levels, and more extreme weather events as well. But climate change has a number of different ways in which it kind of adds to the burden of disease. So if we start maybe at 1 o'clock on this, air pollution. So the burning of fossil fuel generates not only greenhouse gases, but also particulates and other pollution as well. So that contributes to asthma and cardiovascular disease. I spend most of my work overseas in Southeast Asia and Sub-Saharan Africa. And I saw the impacts of malaria and dengue fever, for example, on vulnerable populations. So we have changes in vector ecology. And it's not just confined to Sub-Saharan Africa or Southeast Asia, but it's sweeping up across Southern Europe and into Northern Europe. So diseases like dengue fever. And that's reflected in some of the work that my other colleagues in the National Environmental Health Service at the HSE are doing, where we monitor for invasive species of mosquitoes at the ports. And looking for the species of a mosquito that can transmit dengue fever, for example. Lyme disease is another one that we might be aware of in Ireland specifically. So globally, more and more people at risk of vector-borne illnesses. With longer growing seasons and warmer temperatures over a longer period of time, this increases aeroallergens in the atmosphere, contributing to respiratory allergies and asthma. And then if we look at water, so declining water availability and unpredictability of rains, for example, has an impact in two ways in terms of the quantity of water, but also the quality of water. So declining water quality can contribute to other waterborne infections, such as cholera, which I would have dealt with a lot again in Sub-Saharan Africa. But here in Ireland, we have cryptosporidiosis and we have VTEC, for example, which impacts on our water quality here in Ireland. The biggest indirect impact of climate change on health is in relation to water and food security. So without water for crops, either rain-fed irrigation or whatever, this contributes to declining food security, and declining food security contributes to malnutrition. And if you are malnourished, you are also more susceptible to infectious diseases like diarrhea, for example. If you can no longer support your livelihood on your land, you are maybe forcibly displaced due to environmental degradation. So this is forced migration. It can lead to civil conflict, either locally or between nations or regionally. And one aspect of kind of climate change and health is not to forget about the mental health impacts of displacement on people who have been displaced. Another one is extreme heat. We may laugh at that in relation to Ireland, but I'll make reference in relation to Europe specifically and globally. There was just an RT report actually this morning from George Lee about attribution and climate change events and the impact of heat on mortality and morbidity globally. So heat contributes to heat-related illness and death, such as cardiovascular failure. And then I suppose the severe weather events is kind of the poster boy of climate action, and that contributes to injuries, fatalities, and mental health impacts. But as you can see there, it's not just in relation to severe weather events that impacts on health, but a whole range of other ways in which health is impacted by climate change. Next slide, please, Gary. So the environment as a whole, those of us who work in the discipline of environmental health will be well aware of this, that 12.6 million, or but nearly a quarter of all deaths globally, are attributable to the environment or to modifiable environmental factors. And climate change has a multiplier effect. It actually makes these things worse. It's not the only thing on its own that contributes to the burden of disease globally, but it adds to that burden of disease. So you can maybe expect that more and more people die in relation to modifiable environmental factors in the future. Next slide, please, Gary. But it can't be all doom and gloom. We must identify that climate action also presents the greatest opportunity for public health and delivering a health co-benefit. Now, I only joined South Dublin County Council there in January, and I can see a lot of the work that we do here in the county is trying to deliver a health co-benefit. So one of those areas in relation to better air quality. So if we can reduce particulate pollution and nitrous oxides from shifting our transport modes, following the avoid, shift and improve, things that is mentioned in the Climate Action Plan, avoiding travel, shifting the mode of transport or improving the mode of transport that we use, that can deliver respiratory and cardiovascular health benefits. We also heat our homes using fossil fuels in many respects. We can improve by air quality by reducing the use of fossil fuels in heating our homes. And maybe in the future, and not so far in the future, the way in which we use energy to cool our homes also can improve air quality. I'm sure we're all aware about sustainable plant-based diets. These generate less greenhouse gas emissions in production, and they also help to address our chronic health issues such as diabetes, obesity, and cardiovascular disease. And you can see also the active travel photograph there can also contribute to achieving health gains in relation to those particular illnesses that are highlighted. And then green and blue spaces. So green and blue spaces can help to sequester or capture carbon, but they also support biodiversity through our green corridors that I learned from Lawrence Colleran there a few weeks ago. But they also provide shade and cooling to combat the urban heat island effect and the incidence of heat stroke and heat-related mortality. Next slide, please, Gary. So how does that fit into what work that we do in South Dublin? Well, there was a thing called the Healthy Ireland Framework, published in 2013, which concluded in 2025. It's currently going through a period of consultation. I think the public consultation period has just ended. But the vision that was stated in 2013 is that a healthy Ireland where everyone can enjoy physical and mental health, and well-being is valued and supported at every level of society and is everyone's responsibility. So it is everyone's responsibility in society to deliver upon the vision of a healthy Ireland. And I know we in South Dublin County Council are major players in delivering upon that vision. Next slide, please, Gary. So for me, as a public health person, I put health at the centre. I have some graphics there in relation to the Sustainable Development Goals, and I do have my SDG pin here. You may not be able to see it, but just to highlight that in relation to climate change, health is really only getting onto the agenda in more recent years, even though we've had these Conference of the Parties running since 1992. It was only really in COP28 at the UAE just a couple of years ago or last year, where they made a formal declaration on climate and health. And this recognises the urgency of taking climate action and the health benefits that such action can produce, as we outlined in the last slide. I mentioned the Lancet Countdown. Normally they publish a global report at the end of October every year in advance of the COP to inform the COP, which is held at the end of November every year. But the Europe report was only launched there in April, just a few weeks ago. And it states that climate change is already costing lives in Europe and the health risks are accelerating. And we have a role and a responsibility to play in relation to addressing those risks. The EPA carried out a national climate change risk assessment. It was only published there in 2025, and it also recognized the cascading impacts across systems, including health systems. And we have the National Adaptation Framework of 2024. And this was published in June under the subtitle Planning for a Climate Resilient Ireland. So as a public health person, I put health at the centre. You see SDG 3 is around good health and well-being for all of all ages. But you can't achieve that unless you have clean water and sanitation, which is SDG 6, climate action, SDG 13, clean and affordable energy, SDG 7, or sustainable cities and communities, which is SDG 11. It cannot be achieved without having action in each of the other 16 SDGs. Next slide, please, Gary. So I mentioned the Europe report of the Lancet Countdown, and it might shock you, it certainly shocks me, that in the summer of 2024, it was the hottest on record in Europe, and heat-related deaths in Europe alone were estimated to be 62,775. 62,775 people died as a result of extreme heat. Most of them would be vulnerable people such as the elderly and extremely young. And globally, just today in the George Lee report, they said that 546,000 people die from excess heat on an annual basis globally. That's a phenomenal figure. But you won't hear that in the media because it's not a single event that happens at a single point in time. It's a quiet killer, and it doesn't get the attention that perhaps it does deserve. Because when we talk about heat waves in Ireland, you often see pictures of children eating ice cream in the heat and enjoying the sunshine by the beach, but it's actually a very significant killer of people. Next slide, please, Gary. So, kind of at a policy framework, just the last couple of slides here. So, under the National Planning Objective 54, the objective there is to reduce our carbon footprint by integrating climate action into the planning system in support of national targets for climate policy, mitigation and adaptation objectives, as well as targets for greenhouse gas emissions reductions. We also have the National Adaptation Framework for 2024. This replaces the 2018 framework. And the subtitle is Planning for a Climate Resilient Ireland. And I suppose the leaflet that we're launching today is about trying to improve the resilience of the Irish people and the people in South Dublin in particular. So it's referencing to adaptation, but I just want to make reference to the word maladaptation. So we're trying to address climate change, but in some respects we may inadvertently cause harm. And one example there is in relation to water conservation, and I have in brackets the acronym RWH, or rainwater harvesting. I suppose I'm conscious of this because of the work that I did in Southeast Asia, where dengue fever was a major problem, particularly in the rainy season, where people are harvesting rainwater in these open jars. And the Aedes aegypti mosquito would breed in those jars, and that would help to transmit dengue fever in the population, and particularly under fives, dengue hemorrhagic fever is the biggest cause of death in that particular population. So we have to be careful that if we promote water conservation, it is done in a way that this prevents harm, so that the containers are contained or there's netting included, so that mosquitoes cannot breed and spread infectious viral diseases like dengue fever. But also important to stress that building resilience is not just about the infrastructure, but it's also about building resilient communities. Sometimes we might use the phrase increasing capacity or reducing vulnerability. And I suppose one of the objectives of this leaflet that we're launching today is that we're trying to increase capacity or increase climate literacy within the community of South Dublin so they can protect themselves from the threats posed by climate change. Next slide, please, Gary. And this is the last slide from me. So you can see we have it incorporated within the South Dublin County Council Climate Action Plan 2024 to 2029. So there's an overlap between mitigation and adaptation. So many green climate actions overlap to not only reduce our emissions, but also adapt to the changing climate. I mentioned rainwater harvesting might be something that we promote within the council area. It reduces dependency on energy-intensive treated water, but it also helps us to adapt to drought or to dry spells. And then education, awareness, behaviour change is critical to enabling resilient communities. So you can see circled there in green is the water conservation part, but in our own climate action plan, we've talked about education, awareness, behaviour change, and this is what this leaflet is aiming to deliver. So the leaflet contributes to building that resilience within the communities of South Dublin. So I'll hand you over back to Gary, who will probably outline the leaflet specifically. Thank you, Gary.
Great. Thanks a million, Niall. Really interesting stuff there. And just to touch, I suppose, on a couple of things that you mentioned on the plant-based diets. Just to be a couple of short shameless plugs now, okay? We have, as part of Dublin Climate Action Week this week on Friday, vegan cooking demonstrations in County Hall with Holly White. It was a vegan chef, so she's going to demonstrate some really delicious vegan foods that we can all enjoy, and it'll be there for everyone to eat and enjoy as part of that event. And then on the active travel that you mentioned as well, Niall, tomorrow there's free bicycle repairs in County Hall, as well as a talk at lunchtime, another lunch and learn about bicycle maintenance. So just to move on, to a bit more about the leaflet. So this is something that myself and Niall have collaborated on, and this will be getting launched pretty soon after Dublin Climate Action Week. This leaflet, and we'll have it up on our website, sdcc.ie/climate action. And indeed, it's a good website to check out for lots of stuff that's already up there. We have a lovely story map that we launched a couple of months ago that shows a lot of the actions that's going on around South Dublin County Council, as well as the climate action plan. Lots of other information. We have other leaflets we're launching soon as well about heat pumps and energy tips and tricks and stuff like that. But I think that was a really great whistle-stop tour that Niall gave us there. So I'm not going to read all this word for word now, but just to give you a sense of the type of stuff that we're looking at here, is there's a bit on mold and ways to kind of avoid mold and damp building up in your home. And I suppose a lot of this goes back to the kind of co-benefit stuff that Niall was talking about as well. It's like, stuff that can be good for your health, often can save energy, for example, and that's really, I think, the sweet spot we try and get with any climate action, is trying to get the multiplier effect of stuff where you're saving money, improving your health, connecting better within your communities. And some of these actions do kind of look at those things. Like you look at, for example, in the active travel one there, I think this is a really good one that I try and hammer home a little bit with my family and friends. That many of our journeys that we all take in our cars are 3 kilometers or under. And I think sometimes it's just the force of habit of getting into the car to go down to the shops, for example. And instead, try and break those habits and just going for a walk instead. And you'll actually feel better, and go for a little spin. You probably know the amount of cycle lanes that have gone into South Dublin in the last number of years has been fantastic. So just little things like that, and also another habit to help people get out of is the idling of cars, particularly around schools. You might see some schools now have signs outside them to encourage people to actually switch their car off if they're waiting for their child, rather than having the car idling, because that's obviously emitting more fumes locally. So it's just about awareness is the first step for any of these types of things. So by being here today, or by watching the recording afterwards, that's huge. That's the main thing, I think, just having that awareness and to stop and pause and see where we can make those little tweaks in our lives. And look, nobody's perfect, so we're not looking for perfection, but just having a look, and everyone's situation is different, and just seeing what ways can you look at improving your health a little bit, whilst at the same time reducing your emissions in one way or another. Niall also talked about like that. It is a staggering number, isn't it? The 62,000, over 62,000 deaths per year due to heat. And I think some of that will be attributed to the urban heat island effect, which I don't see much of that being talked about in the media and stuff. But that's essentially, if you think of cities can be like batteries, and they're absorbing all that heat, particularly in the summertime during the day, particularly dark surfaces. all that heat is being absorbed during the daytime, and then at night it's slowly emitting that heat again. So it's and the body, especially for like the vulnerable in our society or older people, it's harder for them to cool down, and that's where a lot of those deaths can be attributed to. So normally, if you're being out in the sun and it's been a very hot day, for example, at nighttime, then your body gets a chance to cool down while you're sleeping, but the urban heat island effect can kind of negate that a bit. So this is talking, explaining what it is a little bit in the first instance, but then offering some kind of low and no cost solutions that we can do to just simply greening our spaces a little bit. And again, going back to that co-benefit idea of, if you can plant more trees and plants and stuff like that, obviously it's going to help biodiversity, as well as helping to negate the impacts of the urban heat island effects if you're living in a built up area. And as well, they look great, they're good for our well-being as well, planting trees and plants and stuff like that. So I'm just conscious of time, so I'll just maybe leave it at that. And just to say as well that there's in this leaflet, there's some really good links and that we've put in as well, with some stuff that South Dublin has already done with the likes of SUDs, or sustainable or urban drainage systems, and to help with flood reductions. And the Winter Ready leaflet is another good one that the government has produced, and that's to help us prepare, in the winter time. And kind of one nice one that jumped out at me from that was, I think it's nice if you can just to check in with people, your neighbours or your family or friends, particularly if they're anyway vulnerable, and just to let them know that you're there and to make sure that they're okay. And particularly, with extreme weather events or anything like that. So look, we will be launching this leaflet pretty soon after Dublin Climate Action Week. But I'll leave it at that for the moment, and I'll just stop sharing just with the last few minutes that we have here, just to pass over to everybody and to see if anyone has any questions or comments that they'd like to make. The floor is open. And just while you're thinking there, just to thank Niall again. It's been great, and we were saying as well earlier, we're looking forward to seeing what other cunning plans we can hatch and get up to over the next while. So if you have any suggestions afterwards as well, indeed, we'd be happy to hear them. We have an email address, climatechange@sdublin.co.ie. If you'd like to email us with any suggestions or any feedback, we'd be more than happy to hear that from you. So look, I suppose just to finish on a positive, and just to say, like, I really like the stuff that Niall had there about the solutions, and there is some of those solutions in the leaflet as well. It's about, obviously, climate change is a very serious issue. The climate crisis, it's probably the biggest challenge that we have as a global society. But there are definite things that we can do in our own lives that can make us happier and healthier, more connected, whilst probably saving money in some instances as well, even. So just thanks so much everyone for joining today. We hope we gave you some hopefully some ideas to think about, and maybe as well, feel free to use these materials to talk to others as well. I think talking to people is one of the most important things that we can do, helping to raise awareness. Gabriella, you have your hand raised there.
Yeah, sorry, I can't come up in the camera, but just a quick question. Will you be sharing the materials by email, or is there anywhere that we can find the link that we can find everything?
Yeah, if you're okay, Niall, I could share Niall's not there. Yeah, absolutely. No, okay, right. Thanks, Niall. Yeah, I can send the slides to everyone that's registered today. Gabriella, sure, no problem.
Great, thank you. Thanks.
No problem at all. Okay, guys, if there's no other questions or comments, thank you very much for joining us today. So yeah, just a reminder that Dublin Climate Action Week is the website for all the other events that's going on throughout the week. So I hope you got something from today, and we'll see you again. And until then, guys, all the best. Take care. Thank you.
Great.
Thank you very much, guys.
Thank you. Thanks.
Bye.
Bye. Great stuff.
So, Gary, well done. Thank you.
Yeah, brilliant, Niall. So yeah, I'll share those slides with everyone afterwards, and so look, yeah, I'll give you a shout, or you give me a shout in the next week or two afterwards, and we can touch base and talk about what our next steps with, I suppose, with the leaflet first off, but then also what else in the future, and I'll look, and as well as I mentioned, whenever I have updates on the air quality stuff as well, I'll give you guys a shout.
Yeah, no, that's grand. Now I'll be off from Wednesday week. I'm going to a conference. We have our association conference in Cork, and then I'm on my 2 weeks of shorter working year. So I'm not back until the 9th of June then. And
Okay.
Siobhan there, who's our senior, she's actually leaving in the middle of June, unfortunately, as well. So, but at least, well, Sarah's still here. You met Sarah anyway.
Yeah.
So
Yeah. Okay.
she won't be going anywhere for a while yet. But I think that was, I know we only had 10 people there, but it's a step.
Oh yeah,
and they can also maybe influence other people, and then we just maybe keep something going as a continuous process of this awareness raising, and then coupled with the behaviour change support that you have been providing within the council here, that'll all add up. Yes, so yeah, no, I'm all on for any kind of engagement, either with communities or with staff, to support that process of behaviour change and reducing our emissions.
Fantastic.
Yeah, grand. Lovely, Gary. Thanks a million for all you've done.
It's just about being consistent. So we'll keep going, and definitely with more of the same going forward. So yeah, okay, sure. Look, I'll chat to you soon. When I get this edited and up on YouTube, I'll send you the link of this recording as well.
Lovely. Thanks a million, Gary. It'll be going across the entire National Environmental Health Service, HSE as well.
Well, fantastic. Brilliant.
Hopefully, yeah. See you.
Okay.
Thanks.
See you now.
Bye.
Cheers. Bye.